bless my mother's heart, she talked to me about the birds and bees, but not about menopause. I mean, it's just one of those things that, did you guys?
My mother never, ever said a word about it. She never warned me about it. And I had to kind of figure it out on my own. And some of my friends are a little older than me started complaining about it. And I said, so what's the deal with menopause? And they started telling me their symptoms. I'm like, oh no, I'm not doing that. I'm not going through it. And here we are.
I don't understand why it's not talked about and why, like, you get prepared for your menstrual cycle. Your mother talks to you about it, tells you what's going to happen, how your body's going to change, but they don't talk about how it's going to change again later in life. It's just not talked about.
Right. It's a taboo subject. That's crazy.
It is. There's like a stigma attached to it. And even younger women, when you mention menopause, they're kind of like, they don't want to discuss it.
Exactly.
My mom never talked to me about it. I only noticed when all of a sudden she changed. And she was having hot flashes and acting crazy.
Wow.
So that's the only thing I knew about menopause, was that you're gonna get crazy and hot. Yeah, hot mess.
But you know, those days are gone, and we're gonna have an open discussion on the balancing act because the doctor is in the house. He's my friend at this point. Rejoining us now on the show for our series of reports, Take Back the Bedroom, is our resident sexuality expert, board-certified gynecologist, Dr. Michael Krychman, a renowned doctor of sexual medicine and co-author of The Sexual Spark. Welcome back.
Great to be here.
Great to have you. All right. So this is something that I think is huge to talk about. You heard those ladies. You know, we've gotten better, but we're not there. It's still a taboo.
Well, I think you're right. You know, so many women think that menopause is like their grandmother's menopause. You know, an old, rickety old lady sitting on a bench, rocking her life away. But it's not like that. You know, as women age, they're vibrant, they're sexy, they may be running corporations or hosting TV shows. You know, they may be doing a variety of wonderful things, and they want their sexy back. They want to be active, vibrant, and really menopause shouldn't hold them back.
It should not, and it should not hold them back from talking about it because it's a reality. You've taught me so much. It's gonna happen to me. It's gonna happen to every woman out there. So let's talk again about menopause and what kind of happens in that intimate area.
Oh, come on, say it. Say the word. We've been here for so long. Come on, what is the word?
What happens to the vagina?
There. Wasn't the worst thing in the world, right?
No, it wasn't. After so many segments with you, I should be okay with it, but even I still shudder.
Well, I think that says something really important. We're now breaking the conspiracy of silence as we get more comfortable, as people are volunteering information, and it becomes to the forefront of concerns. I think we're becoming more comfortable, both the clinician, the doctor, as well as the patient. So we have to ask, and we have to tell patients that they need to tell. It's important to know that the vagina and vulva, we can say that word too, right?
We can. I'm glad you said it.
Say it.
Vulva.
There you go. Okay, so those things change. The hormones decline and they become irritated, red. They can become really painful. And really, you know, it's not the way a woman should be spending 40% of her life.
So what do we do to alleviate that issue, to alleviate the dryness, the pain, the changes that are happening, to alleviate the fact that many women, as you've taught me, are having sex with their husbands and enduring that pain? What can we do to help that?
Well, I think there's quick, easy, simple solutions. You know, it starts from the very beginning of how you take care of your skin. We take care of our face, we use special products, natural cleansing. You know, we have a protective oil barrier on our skin, and it's the same thing for the vulva and vagina. So we need to choose products that have excellent ingredients, things like Lubrigyn cleansing lotion. It's not foamy. It doesn't have lauryl sulfate, that foamy, harsh detergent.
Which makes it worse.
Right, and it strips away the natural protective oils. So we have to really be careful about the ingredients that are in and the ingredients that are not in as well.
And how would I and other ladies out there use these two products?
Well, Lubrigyn is really, I think, is a part of a system. There is the cleansing lotion for the outside. It helps with the moisturizing, it helps with elasticity, it cleanses as well. And then you also have the cream, which can go inside and helps maintain the supple quality of a vagina. And you know every woman really wants a supple vagina.
Yes, absolutely, I do. Although I'm not going through it yet, I do. So the reality is, it is a sensitive area. It is an area that no matter what, will be affected, and we need to use something sensitive to take care of the issue.
Right, and I think women need to be empowered to make good decisions. They need to read labels, they need to take the time to take concern for special products that are going in the intimate area, and I'll say it too, the vagina,
Yes.
and in the vulvar area as well. Very important.
And something else that I find very important as well is I do think they also need to communicate with their husbands or their partners. They need to show them what they're using. They need to explain what's happening. And at that point, it becomes a duel.
Husbands, partners want to maintain that intimacy.
They can understand.
And they can understand.
And then it gets even better in the bedroom.
Right.
Thank you so much, as always. I've had so much fun with you. All right, I'm going to say the word one more time. Ready?
Okay, we'll say it together.
Vagina. I love you. All right. By the way, real quick, for information on Lubrigyn Cleansing Lotion, where do we go, doctor?
You can go to lubrigynusa.com.
All right. You can also go to our website, thebalancingact.com. My grandmother in her grave, oh my